Welcome to all. So today we are going to see drug-induced hyperthermia part 3, that is serotonin syndrome. As an emergency physician in your viva and also in your real-time practice, you'll obviously see patients with elevated temperature. Okay. So apart from coining them as sepsis, we need to know what are the other causes of hyperthermia. Okay. Other simple causes of hyperthermia like DVT or any drug-induced minimal fever, all those things is not going to come to your emergency department, right? So in emergency department, non-infectious causes of fever, you must be able to evaluate. You cannot coin any patient who coming to your emergency department with fever, hypotension and altered sensorium as sepsis, right? I am not denying it can be sepsis, but you need to look into other causes of drug-induced hyperthermia also, because the management completely differs. Especially as far as an emergency physician is concerned, the first 1 hour management of the sepsis is different and a drug-induced hyperthermia is different. So it is for that reason you should be aware of what is serotonin syndrome, malignant hyperthermia and the MS, which we'll see in further later. So this topic is on serotonin syndrome. What is serotonin syndrome? It's basically an overstimulation of serotonin receptors in the CNS, right? So the patient presents with a combination of altered mental status, autonomic hyperactivity and your neuromuscular abnormalities. Okay, this combination is called as serotonin syndrome. Okay, why are we speaking about this in current era is that there is an increased usage of SSRI in current world. So when the increased incidence of SSRI is there, there's going to be increased incidence of this serotonin syndrome as well. So what is this? The serotonin is a neurotransmitter that participates in the sleep-wake cycles, the mood and thermoregulations. Many of the drugs involved in this serotonin syndrome are basically mood enhancers, and mostly they can be like an illegal substances like ecstasy, which is an amphetamine derivative, and it causes very severe form of serotonin syndrome. And this is less likely in southern India or even complete India, but when you're going to abroad, you need to think of all these things when you're seeing a patient with muscle rigidity, altered mental status and hypothermia. Okay, we'll see these things in detail. So now, how can drugs produce serotonin syndrome? Is it only because of elevated serotonin or by inducing serotonin or by various other mechanisms? So the mechanisms involved are, it can be increased serotonin synthesis or decreased serotonin breakdown or increased serotonin release or decreased serotonin reuptake or direct agonist at the serotonin receptors. All these things can cause increased serotonin like features. Okay, so we call that serotonin syndrome. So increased serotonin synthesis by L-tryptophan, which is actually a component required for serotonin synthesis itself. And decreased serotonin breakdown is your MAO inhibitors, that is linezolid, ritonavir sort of things. So increased serotonin release is by amphetamines, MDMA, that is ecstasy, cocaine and fenfluramine. Decreased serotonin reuptake is this SSRIs, TCAs, dextromethorphan, meperidine, fentanyl, tramadol. Okay, as an emergency physician, you're aware that we are using fentanyl left and right? So you should be aware of whether the patients are already on SSRIs, TCAs or any of these drugs. Okay, post fentanyl, maybe in another few hours, the patient develops very severe sort of rigidity or high temperature. You must be knowing what is the patient's regular medications are. So your diagnosis differs, right? And serotonin receptor agonists are the lithium, sumatriptan, buspirone and LSD.